Hello, my name is Brian Lewis, and I'm an instructor with JTNS. And our presentation today is over bloodborne pathogens. As we do at JTNS, we like to take 5 or 10 minutes and discuss any near misses or accidents that may have occurred in the previous month. So, I'm going to ask you to go ahead and pause the video and take a few minutes and discuss any near misses and or accidents that might have occurred. Make sure you find some kind of solution so that people don't get hurt. After you're finished with your discussion, simply push play again on the video and we'll get right into the presentation. Okay, hopefully you had some productive discussions around near misses and accidents and how to avoid them in the future. And we're going to talk about bloodborne pathogens now and how we need to protect ourselves. So keep that in mind. So our objectives: we want to define what a bloodborne pathogen is. We want to recognize the OSHA standards related to bloodborne pathogens and their instructions, identify employer responsibilities and compliance with the OSHA standards. How do we keep ourselves safe? That's important when we talk about bloodborne pathogens. So, bloodborne pathogens, they are pathogenic organisms, microorganisms, that are present in human blood or other potentially infectious materials, OPIM, and can cause disease in humans. So let me unpack OPIM. If you're using a table saw and you cut off a digit, that digit is OPIM. Now, if you go to pick up that digit in the hope that a doctor can sew that back onto the person who lost the digit, you want to use gloves, you want to protect yourself, you want to assume that it has some kind of bloodborne pathogen associated with it, and after you put on your gloves, you use a clean cloth or towel, wrap it up, put it in a Ziploc bag with ice. So that's how you want to handle that. So pathogens include, but are not limited to, hepatitis B or HIV. And there are others, but these are the ones you hear about in the popular media, and certainly they're the ones that a lot of people are concerned with, and rightfully so. These can change your life if you're not careful. So keep that in mind. A little bit about the OSHA standard. If you want to read about it for yourself, you can go to 29 CFR 1910.1030 and read about occupational exposure to bloodborne pathogens, the OSHA regulation. Now, this was first published in the early 90s, and it's gone through a revision in the early 2000s, okay? So all occupational exposure to blood and OPIM or other potentially infectious materials are covered in this standard. So you might hear that and think, well, this is about doctors and nurses, and that's true. It is about doctors and nurses, but it's also about other people also. There's a lot of people that have a potential risk and potential exposure. It's not just doctors, nurses, EMTs, paramedics, people who are involved with emergency services. OSHA estimates that there's 5.6 million workers in healthcare and other facilities that are at risk of exposure to HIV and hepatitis B. However, there are other people. And it can be utility workers, either on the public works side or on the electrical side, and it can be people in the office also. It can absolutely be people in the office. Someone falls, they cut their head or their scalp, and as you know, any kind of injury or any kind of cut on your scalp, there's always a lot of bleeding that goes along with that. So you have to assess the situation. Make sure you contact EMS, Emergency Medical Services, for the head injury. You don't want to take those things lightly. Get the first aid kit and put on the personal protective equipment. Okay, I'm going to say that again. Get the first aid kit and put on the personal protective equipment. Now, hopefully there's no arterial bleeding or anything like that, and you can simply put on the right size gloves, the correct size gloves, get some gauze or what you need, and apply pressure. Stop the bleeding. Go with what you've been trained to do in first aid. Administer the appropriate first aid. Clean up and dispose contaminated surfaces and materials. And what I'm going to tell you is that in every step of this way, whether it's the person giving the first aid or it's the person that's cleaning up and disposing of the contaminated surfaces and materials, there needs to be personal protective equipment included, and you need to protect yourself. So keep that in mind. So occupational exposure is any reasonably anticipated skin, eye, mucous membrane, or other parental contact with blood or other potentially infectious materials that may result from the performance of job duties. They can mean taking care of an injured coworker. It can be that you're part of environmental services, exposure to waste or sewage. There are others. I'm sure that there's plenty that I cannot think of and are not listed here on this PowerPoint slide, but there's plenty of people, plenty of jobs where you can reasonably anticipate that you're going to be exposed to someone's blood or OPIM. So keep that in mind. So one of the key components of an exposure control plan, which you're required to have, is an exposure determination. Now, all the exposure determination is, or all it means, is that the employer lists all of the job classifications or employees in those job classifications that have occupational exposure. So we know that these people, through the performance of their job duties, are going to have reasonably anticipated exposure to blood or OPIM. So, obviously, people in the medical profession, right? The next thing, part of the exposure determination, is job classifications in which some employees have occupational exposure. So the first part of the exposure determination is all the job classifications of employees who have occupational exposure. The second part is job classifications in which some employees will have occupational exposure. All tasks and procedures which occupational exposure occurs and that are performed by the above listed employees. So every job classification where there is definitely going to be exposure, then all job classifications where some of the employees might have exposure or some of the employees have exposure. And then the third part is you want to list out the task and the procedures in which occupational exposure occurs. So whether that is being trained in first aid and taking care of a injured coworker, or whether that's the performance of job duties, and employees, whether you're trained in first aid or whether you're going to participate or you work in contaminated water or solids like people do when you deal with waste, those job classifications have some exposure in them, have exposure. So the exposure control plan also has to include a schedule and method for implementation for how are you going to comply with the rule, how are you going to comply with the regulation, how are you going to protect people. Are you going to have some engineering controls? And if you can, you have to use engineering controls. Are you going to use PPE? How are you going to do that? Are you going to train people? Are you going to tell them? How are you going to tell them about the hazards that they're going to potentially or be exposed to? How and when are you going to offer the hepatitis B vaccination and a post-exposure follow-up? keeping records. How are you going to secure those records? That's important. All of that's important in the exposure control plan. The procedure for evaluation of circumstances surrounding the exposure of incidents. Immediate availability for exposed employee to confidential medical evaluation and follow-up. If you get someone else's blood in a cut on a patch of dry skin in your eyes, your nose, or your mouth, you have had an exposure incident. So you have to go and have medical attention. You have to have a doctor sit down with you and in a confidential manner talk about what your medical treatment options are and what your risk are or what your risk is. Need to talk about how to protect your family members. This is all part of the confidential follow-up and medical evaluation. Hopefully you've got the source individual's blood and it can be tested, and the doctor can look at you, or the medical professional can look at you and say, you know what? This person didn't have any bloodborne pathogens. You're okay. This doesn't occur all the time. Sometimes you just don't know. The doctor needs to know how you were exposed, what the route of entry was, the route of exposure, what were the circumstances when this incident occurred. That way that doctor can tell you about the risk that you have of contracting hepatitis B or some other bloodborne pathogen like HIV. There are drugs out there now that they can use to treat these conditions. I don't know that they always say that they're, quote, cured, but people that have had HIV, they have a hard time finding it in their blood anymore through the use of some of these drugs. These drugs are powerful and they have some severe side effects. Part of the seriousness of this and why you have a confidential meeting with a medical professional is to determine what your risk is and whether you want to take the drugs. How are you going to be tested? How are you going to be tested? It's important and it shouldn't be taken lightly. So keep that in mind. I don't mean to be scary, but I do mean to be straightforward. I do mean to be straightforward because we're dealing with some real serious issues now. Real serious issues. So, universal or standard precautions. You may hear either of those phrases. Used to be universal precautions. A lot of people have started using the word or the phrase standard precautions because they should be standard. Universal used to communicate the idea that you considered everyone's blood contaminated. Universally, everyone's blood was contaminated, and because of that, you wore your gloves and your PPE and used engineering controls to make sure you didn't get someone's blood in your eyes, nose, or mouth, or in an open cut or in a patch of dry skin on yourself. Now the idea is this is a standard way to do business. A standard way to do business. So those are the ideas behind the standard and the universal precaution phrases. So those precautions, treating everybody's blood as if it's infected, as a standard and a universal precaution, shall be observed to prevent contact with blood or other potentially infectious materials, and all body fluids shall be considered potentially infectious materials. Good information. So you have to use universal or standard precautions, whichever phrase you prefer. Engineering and work practice controls. The whole idea here is to eliminate or minimize employee exposure. To have readily accessible hand washing facilities. Now, when you're out in the field, you're not going to have access to hot water and hand soap all the time. What they say is, and what you can do is have hand sanitizer, and a good alcohol-based hand sanitizer. Use that to sanitize your hands, and then as soon as you get to a hand washing facility with warm water and soap, wash your hands thoroughly. So that's the idea there. Contaminated sharps management. If someone gets cut on something and it's a knife or it's some other kind of sharp tool, how you handle that tool. You handle it with gloves. You treat that blood like it's contaminated until you can decontaminate that particular piece of equipment, right? Now, when they talk about sharps in this standard, they're talking about scalpels and other medical equipment, needles, things like that. But typically, when we're talking about utility and we're talking about the work that Public Works and linemen do at electrical utilities, we're talking about tools. So you have to manage those things, and you have to manage the cutting edge. Make sure you keep those things safe, and if there's blood on them, you decontaminate them. Keep food and drink out of the work area. Anywhere where there's blood or OPIM, it's not a good idea to be putting stuff up to your mouth. That's the idea right there. So if there's somebody accidentally cuts off a digit, that's not a good thing. But the way you make sure everybody else is protected is you don't handle that digit and have something there to drink or eat. Just not a good idea. You want to avoid that. So, procedures involving blood handling. There again, having the appropriate PPE, knowing how to decontaminate surfaces, that's important. The transportation of specimens. There again, particular to utility work, if somebody cuts off a finger or a digit, you want to use your PPE. You want to use a clean towel. Follow your first aid procedures to gather up that finger or that digit in the hopes that medical professionals can reattach it. But you definitely want to protect yourself. That's OPIM. Make sure you do that correctly. Now, contaminated equipment, I've already mentioned, and contaminated surfaces in particular are really important to talk about. So you want to decontaminate those surfaces before you wipe up the blood, okay? The reason you want to do this is if you start wiping up blood or bodily fluids before you decontaminate the surface, all you're doing is pushing these microscopic pathogens all over the surface where they can live. So you want to use a fresh solution, 10% bleach and water, or some other EPA approved tuberculicide, spray it on the surface or pour it on the surface. In the case of 10% bleach and water, you want to let it sit there for 10 minutes and before you can consider it decontaminated to wipe up. Some of the other chemicals that are available for decontamination have different contact times, and you'll just have to read the container to determine what that contact time is, because there's a lot of different and various types of decontaminants out there with different contact times. But the idea here is if you kill the pathogen, in other words, decontaminate it before you start wiping up or cleaning a surface, you do not take the opportunity or chance to spread that pathogen all over the surface. Some of these pathogens can live on a surface for anywhere from a few hours to days, depending on if the conditions are correct or right for that kind of thing. So you really want to make sure you decontaminate the surface before you start wiping stuff up. So, PPE shall be used when exposure remains after institution of engineering and work practice controls. Employer shall provide PPE at no cost to the employee, and it can be gloves, face shields, mask, eye protection, mouthpieces, resuscitation bags, pocket mask, or other ventilation devices. You want to wear it and you want to dispose of it the correct way or properly. So keep that in mind. How do you dispose of it? Well, one of the things you need to do is maintain a clean and sanitary condition. That's the work site. It needs to be maintained in a clean and sanitary condition. Cleaning and decontamination of all items and safe disposal of the contaminated materials in the provided marked containers. So these are typically red bags with a biohazard label on them. If you've contacted emergency management services, a lot of times you can hand this bag to the people, the EMTs, the paramedics in the back of the ambulance, and they'll take it to the hospital and make sure it's disposed of properly for you. So, regulated waste. So, what do we do with it? It needs to be closable. It needs to be constructed to contain all the contents, labeled or color-coded, closed prior to removal. If outside the contamination, the container occurs, it shall be placed in a second container. So if you get blood or something outside of a red bag with a biohazard on it, maybe you have to double bag it. Maybe if there's something there that's sharp and can poke through a bag, you need a puncture-resistant container to put it in. Need to consider all of these things. Disposal of all regulated waste shall be in accordance with the regulations. So you just don't put it in the trash. You make arrangements with the local hospital or the emergency services. Like I said, in most cases, the people with emergency services will handle that for you. So keep that in mind. Contaminated laundry shall be handled as little as possible. Bagged or containerized at the location where it was used, and the containers labeled or color-coded in leak-proof bags or containers. Employer shall ensure all employees who have contact with contaminated laundry wear protective gloves and other PPE. May require shipping to off-site facility for cleaning and or disposal. So, most of the time when you read something like this pertains to hospitals. Nurses give shots, IVs, all kinds of things, and once in a while a dirty or a contaminated needle finds its way into a bed. And the people who do the laundry need to know how to handle that situation. However, if somebody gets hurt out in the field, you're going to be cutting pants. If they've got long sleeves, FR clothing on, something like that, you might have to be cutting off sleeves and doing all the things that you have to do in first aid to try and help your friend, your co-worker, survive whatever has happened to them. That's laundry. That's laundry, and you need to have a plan for it. It's pretty straightforward stuff. So you may hear me say some of these things. You may read some of these slides and think this only occurs in hospitals or doctor's offices. But I can imagine scenarios in utility work where cloth, pieces of shirts, pieces of blue jeans, things like that, gloves, all that's considered laundry. So you need to have a plan. How to dispose of that. Hepatitis B vaccination and post-exposure management for any exposure. The employer shall make available the Hep B vaccine and appropriate medication to all employees who have occupational exposure. Post-exposure evaluation and follow-up to all employees, no cost, at a reasonable time, to a licensed physician or healthcare professional. According to the recommendations of the U.S. Public Health Service, all lab tests are conducted with accredited labs or at and by accredited labs at no cost to the employee. So the post-exposure evaluation and follow-up need to document the routes of exposure. How did you get the blood there? What are the circumstances that you got that kind of exposure? You need to identify and document the source individual. If you can, you want to obtain the source individual's blood and have it tested for HIV, hepatitis B, and any other kind of bloodborne pathogens. That gives the doctors critical information, if you can obtain that, to give you some idea of your risk and to recommend what kind of drugs you might take going forward. Collection and testing of blood for HBV and HIV, that's your blood as well as the source individual's blood. Post-exposure prophylaxis and care. So there again, this is the drugs. These drugs are powerful, and they can have powerful side effects. You need to have a confidential discussion with the doctor and discuss what you can expect from side effects if you take the drugs, and how important is it that you take the drugs. You need to have counseling. You need to have counseling. How do you protect the people you live with and the people you interact with every day should you convert to HIV or hepatitis B? An evaluation of reported illness. If you convert, how are you going to do that? How are you going to deal with it? How serious is it? All this needs to be done in a confidential manner. So, like I said, this is a serious issue. Some people don't really want to consider how serious it is, but I'm telling you, this is one of these things you got to have a plan for. Communication of hazards to employees. You want to use labels and signs. Information and education. Anytime that you're going to be potentially exposed to any of this stuff, somebody needs to tell you about it before you jump into it, right? If you're going to be trained in first aid and you're expected to render first aid as a part of your job, need to know what you're in for, need to know why you use your gloves. If you're going to do breathing for somebody, why you use a one-way mask. You need to be have this education and information presented to you at least annually. You need to be reminded. We all need to be reminded of how serious this is. If there's any changes in the exposure control plan, any changes in the regulations or standard or new information becomes available, it needs to be part of the training. Most people ask me, how long is a hepatitis B vaccination good for? And I believe the CDC at the time of me making this video says 10 years you need to be checked and make sure you still have antibodies. Now that may change. So check with the CDC website. Do a little bit of information gathering. How long is that hepatitis B vaccination good for? Do you need another round? That sort of thing. The content and vocabulary appropriate to educational level, literacy, language of employees. This just means that if I only understood German, it wouldn't be a good idea for somebody who spoke English trying to communicate this to me. It should be communicated in a language that we all understand. Information education needs to be provided to all employees who may be at risk. Shouldn't cost them a thing. And we need to talk about the minimal requirements and list all the training program requirements. And you can find that in the Code of Federal Regulations, or CFR 1910.1030, paragraph G2, Roman numeral 7. It lists all the training program requirements. If you want to go look that up, that's where you would find that stuff. So record keeping. When we're talking about medical records, they need to be or must be maintained for the duration of employment plus 30 years. So as long as you're there, before you retire or quit and move on to something else in life, those medical records need to be maintained for that time plus 30 years after you leave. They need to be obviously secured so that they're not accessible by just anyone. Training records shall be maintained for 3 years from the date of the training. So when you go through this video or you go through some of our in-person training, you need to make a record of that training, hold on to it. The employer is required to hold on to it for 3 years, and we would request that the employer send us that information so that we can maintain it for at least 3 years. So at any rate, the employer's going to be responsible for maintaining this, and we like to capture all of that training information and help maintain it for the 3 years. Why do we not have people that are 100% on board and take bloodborne pathogens and universal or standard precautions seriously? A lot of times it's just because no one's ever told them. They lack training because no one's ever told them. No one's ever taken the time and sat down and explained the risk and the hazards associated with exposure to somebody else's blood. So they don't know. They don't know. That's first. A lot of times people are just way too busy, hectic. They're rushing around. Lives are busy, and there's a lot to do, and you just don't take the time. A lot of times it's a decreased awareness of hazards. So what do we mean by that? If you're old enough to remember the 80s, this was a huge deal in the mid-80s, and it's the reason the standard came about in the early 90s. As time has moved on, it is the information in the public domain on the news broadcast has gone down, and people just simply don't have that kind of information in front of them anymore. So it's a decreased awareness of the hazards and the risk associated with blood and OPIM. The last thing we want to talk about here is a lot of us simply believe it won't happen to me. And I don't know how to explain this, but a lot of people just feel that they're so special that nothing like this could ever happen to them. But it happens to people every day. People every day get hurt. People every day have exposure to blood. We don't want it to happen to us, but we need to be realistic. Need to be realistic in how we evaluate our risk and our opportunity for something bad like this to happen. So keep that in mind. Keep that in mind. Don't be that person that says, this ain't going to happen to me. This ain't going to happen. Stuff like this never happens. Well, nobody ever thinks it will until it does, right? So keep that in mind. In summary, we talked about the definition and the scope of the hazards. We talked about universal and standard precautions. We've talked about how to protect ourselves and talked about OSHA standards relating to bloodborne pathogens. We've talked about the employer's responsibility and what they need to provide. We've talked about the employee's responsibility to report any kind of exposure incidents and anything else like that. So, what I'm going to encourage you to do is think safety, not just compliance. What do I mean by that? I mean, don't think about just doing the bare minimum. Think about what the best practices are and keep those things in the front of your mind and learn what you need to know to keep yourself safe. I appreciate y'all paying attention throughout this video. I hope y'all have a good and safe day. And once again, appreciate your time. Bye.